All right, and we are live. And so that means that we start with a disclaimer. The views and opinions expressed in this podcast are those of the host and their guest and do not necessarily reflect the official position or policy of any institution, nor is an endorsement of any agency or organization. Any views or opinions are not intended to malign any religion, ethnic group, club, organization, company, or individuals, and we respect the fact that people's views and opinions are subject to change. So, welcome back to another week and our fourth episode of Talk Public Health. No, we didn't do an episode last week due to the Easter holiday. If you're joining us live on YouTube or listening to a recording of this episode, myself and Naomi are glad to have you back. And here's the drill. For those of you joining the show on YouTube, please hit the subscribe button and click the notification bell to be aware of when we upload new content.
Yeah, and of course, please like and follow all our other social media channels. We have Facebook, Instagram, Twitter, SoundCloud. I think of all the links are posted in the description section of this podcast. And we would love to get you on board. So, what are we tackling this week? An ongoing saga that has put this UK in the international stage for what many are calling the great unknown, confusing, difficult, contentious. So this week, of course, most probably you would have thought of it, we are addressing Brexit and the public health implications. Charles?
And and yeah, definitely, this on the 23rd of June 2016 and currently has been delayed for completion to October 31st, 2019, has caused so many questions to come up in our discussions with public health professionals and people alike within and outside the UK. And so we plan to explore Brexit in this podcast, and we would love to hear your opinions. As we know that this is such a huge topic, and a 20-minute to 30-minute time frame may not be able to allow us to explore all the diverse issues with it. We're going to try our best, and we certainly will need to do another video on this topic. But with that in mind, we're going to start with our first question, which is, what are the impacts of Brexit on public health and health workforce? So Naomi?
Yeah. Of course. Yeah, totally. That's the first question. And then to start off with, we would like to again appreciate our top public health researcher. It's so awesome to have Annie on board again, as I always say. She has provided us with some data to explore this question. And moving on, like evidently, shortages of the health workforce is one of the biggest challenges that's on spotlight for issues in the health sector, and the World Health Organization who is attempting to address this, we will see that Brexit actually raises big questions around this issue, particularly like, do we, I mean, people living and residing in the UK, require the same number of public health professionals, both in the UK and the EU after Brexit? So the question is, do we actually need more? Because now work will be duplicated. And I think by that, I mean that before, things that were done as a joint effort will now have to be done separately. Right, Charles? Like the UK
Yeah.
will have to do things, and the EU will also have to do things. So yeah, like
Yeah.
that's a big question Brexit is raising.
Absolutely, and like definitely, surprisingly, I think one of the topics that is often explored is this issue of the number of foreign trained doctors. And surprisingly, the annual inflow into the UK has not decreased, at least based on sources from the OECD, which show that in 2016, there were around 116,000 foreign trained doctors. And this actually increased to 118,000 in 2017. However, the stats for 2018 haven't been published yet, and it will be quite interesting to see if this trend will continue. For those who don't know, around 9.7% of doctors in the NHS are nationals of EU countries other than the UK. So, with nearly 10% of this particular workforce being impacted by Brexit, this has great implications if they were all to leave the system.
Yeah, that's actually very interesting because, like, with the foreign trained nurses, I think there are different trends to this because the number is actually decreasing sharply since the Brexit referendum. Because, but I don't think we can yet construe if this like fall is because of impending Brexit. But I think in due course we will know. But statistics and data has shown that in 2016 there were about 9,168 foreign trained nurses, which was previously 10,000, and now it's actually in the range of an outstanding 3,462. So you could see how this is actually sharply decreasing over the past 2 years. And currently, of course, about 7% of the NHS nurses are of EU countries. So we will see that if the numbers of these nurses are falling in the UK, are they actually going somewhere? And if you look at like Ireland, for example, where in the same time frame, the numbers rose from about 1,900 to 3,000. So the question is actually, is this related? And we haven't even talked about the issues that the loss of not only nurses, but also like other allied health professionals like medical assistants that play a vital role in running the health system. So we haven't even looked at that. And you know what I mean?
Yeah, definitely, Naomi. I definitely agree with those sentiments because like losing those like very qualified health workforce members is an issue. But even looking beyond that, there are some really major public health impacts. I know that the faculty of Public Health UK, and that's the leading body for public health specialists in the UK, they have been lobbying and collaborating with organizations across the country to protect public health post Brexit. They did this through the launch of an extensive campaign called Do Not Harm to ensure that they receive government commitments to public health during Brexit negotiations and processes. They've cited some wins or commitments, such as from then Secretary for State for Health and Social Care, Jeremy Hunt, noting that our guarantee of equivalent or higher standards of health protection and health improvement when we have left the EU is unequivocal. So he's saying that, it's going to be better or it's going to be improved once they leave the EU. Who
Yeah,
knows?
yeah, but I believe like also like they have really been lobbying because there's been this pushing to ensure a seat at the table for trade agreements. So there's this like I think the UK doesn't actually want to leave the trade because I see that the UK post Brexit trading relationship is actually having to increase the NHS funding to about 20 billion because since the NHS has been chronically underfunded, so I think they're trying to have like measures to stabilize, but then they have to pump in more money to ensure that their public health sector or the health sector functions as it usually is, right?
Yeah, yeah, and we've also seen like statements coming forward about the UK looking at collaborating with the EU for improving standards around air quality and in food security and our safety and with medicinal products, which we know definitely has long-lasting implications for public health. But I think what's being lost in some of these conversations are the deep social implications that will likely cause even greater health challenges, with evidence suggesting that post Brexit, homelessness is expected to worsen, especially if a no deal scenario was to happen. This is really a terrible combination of a sluggish housing sector, plus sharp declines in the availability of affordable homes, and plus increased job losses, especially in areas where jobs are fueled by EU contracts and grants. And this really ends up costing more in terms of having to provide services for homeless persons and increased socioeconomic issues such as crime and drug and alcohol abuse, increased sexual transmitted infections, and also sexual exploitation and human trafficking and social exclusion and other mental health issues that really are not being talked about enough.
Wow, that's a lot of like impact already on the social context. But also, we could talk about weakened and removal of like workplace protections, because under the EU law there was like workplace protections, and that's going to be changed post Brexit, and that will also impact like job security, safety, and accidents. It will social ripple social impacts, and we could also think about the increases in like poverty or child nutrition, decrease mental health, and all of what about the prices in real wages? I think there's going to be falling of prices, and this would affect the people's ability and family to make healthy choices if their money is reduced. And like you could see that this would actually also impact the society a lot. Yeah.
Yeah, 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 absolutely. And if you have like these increased pricing and people have lower wages, and if the UK begins to then like prioritize being a competitive market for trade and allows either cheaper, unhealthy food, tobacco, and alcohol products to flow in, or due to changes in tariffs and regulations, they allow increased marketing of these items. The UK will have to really consider, will the economic gains of allowing these cheaper products in and these price increases for the NHS be offset by increasing numbers of non-communicable diseases such as cancer and diabetes, because of people, either consuming unhealthy products or like taking a part in these like unhealthy activities, and these implications go way beyond the UK, to I guess neighboring countries. But we don't have as much time to talk about that. We're going to end up though shifting over to our second question, which is what are the implications on clinical trials and medicines? Sorry. Uh,
Bless you.
what are the implications on clinical trials? Sorry, Naomi, you take it.
Oh yeah, okay. So sorry about that, Charles. So of course, the next question is what are the implications on clinical trials and medicines and technologies? I actually heard the British Medical Association made a position paper on the impact of leaving the EU for patients, and they actually really just focused on the access to database for rare diseases. And I think like this is very interesting because for those of you who are not in academia, you will I would like to tell you that the UK is actually a big player in terms of research. And the interesting thing is that about the validity of research mostly depends on the sample size. So how much of the target population does it actually represent? And this is like important in all aspects of research, whether it's done in the Europe context or non-European. And to this note, so it's possible to have clinical trials involving various European countries, which is a representative of the population to ensure that good clinical practice is done across the EU. And as I said before, like the UK is actually a huge player because a lot of the good practices are seen from the UK. But after Brexit, like the UK will lose this influence. And we could actually argue that this is a loss to the EU as it will miss out on the UK's data for like rare diseases, for example. But I think what the UK would lose will be that in some cases, it would not have enough sample size to validate a clinical trial. So that means it would not actually to lose its influence as the top player in terms of clinical trials. And it's really unclear whether the UK could still collaborate with other EU like research institutes, and also to what extent can it do that after the Brexit, and how will it still contribute, or will then this affect the standards of good clinical practice in the UK? Charles, what do you think about that?
Yeah, I definitely think that you've brought up some really, really good points, and I think it even like moves forward into like the ability for the transfer of research into a EU context. As you already highlighted, like there's been groundbreaking research in the health sector, particularly around clinical trials for medicines conducted in the UK. But now there's definitely going to be barriers being like faced in terms of its transferability to the EU, as new laws will definitely have to be put in place after Brexit. And so now we have to think about what will this mean for patients and for
Mhm.
medicines in the EU. This could mean longer waiting times to access drugs and medications due to new laws. This could mean increasing burden of disease and possibly higher mortality rates. Who knows, right? How do you begin to like measure these particular losses? And additionally, there are definitely expected losses in the UK economy due to the impact of pharmaceutical bodies relocating, particularly the European Medical Agency, which moved from London to the Netherlands, right? And
Yeah,
by
sure.
the way, this particular loss was estimated to be approximately £1 billion per year, at least according to a Harvard Public Health Review article. And
Wow.
we really have to consider how would this affect the UK economy and also employment of professionals in this field.
Yeah,
So
that's actually a big one. And even not to leave out the issue of pharmaceutical stockpiling, because a recent report from the British Department of Health actually identify about 7,000 prescription-only medicine that will be at risk in the terms of supply chain if there is a no Brexit deal. So this is absolutely terrifying, especially considering the fact that countries were asked to provide a 6-week buffer of stock for this medicine. So having to wait 6 weeks to get a prescription drug will be really appalling. And although like pharmaceutical companies have tried to extend this courtesy, but in the light of like all the uncertainties that Brexit is synonymous with, I think the public is complaining, and this raises even a bigger issue of what might be the consequences of pharmaceutical companies playing the good guys, you know. So this whole dynamics, it's seeing a different change. But I would say we would move on to our third and final question, and that would be: are there any opportunities for public health due to Brexit? And Charles, what do you think about it?
yeah, well, I know that we've painted a pretty grim picture so far of the severe damage of the UK economy due to Brexit. And it has been suggested that, like, due to this like economic contraction, that the UK may have to inevitably cut back on its aid commitments. And so this opens up some like key questions. Will other countries step up and give more aid? And even though the UK is suffering this major economic hit, should it be allocating even more aid money than before to help with all the administrative costs during this Brexit transition? The UK currently provides around £1.5 billion per year to the EU development and a humanitarian aid budget, and many of these foreign aid agreements with the EU will stand until December 31st, 2020. But what happens afterwards? There's the possibility that we may see fewer UK NGOs applying for EU funding grants, perhaps as a consequence of the EU changing contracts with UK NGOs so that they have to prove that they can continue funding a program in the event of a no deal Brexit, right?
Yeah, but I would say there's also likely to some opportunities for them. For example, UK-based international agencies will need to strengthen their ties with European offices so they could do a joint grant-seeking strategy, even though they might not be. So I think like that would mean they become a third world country or like any other country, but I think that is possible. And also, the UK civil society network, like I think, has this bond because it says, I think in code, like the UK's departure could help catalyze new partnership models for the EU and non-EU countries. So it's also looking at partnerships and enhancing existing joint programs and also donor coordination. So I could see the bright light in this. And I would say it also, even though trade, we have tried to see it in a different light, but it's also a unique opportunity to improve like UK trade and partnership agreements, and it could enhance policy coherence for development, since the UK could aspire to set the gold standard for development friendly trade policy. And this will go beyond the existing arrangement for least developed countries, for example. And I think in leaving the EU, the UK will have the opportunity to set new standards for the use of funding for research and development, and it could actually uh, guarantee greater transparency in the use of these funds for like private pharmaceutical research and affordability of end products. So like I think depending on how the UK tries to approach this, there is more opportunities for them to do something better with this. So yeah, Charles.
Yeah, yeah. Definitely. I think it's about trying to like leverage a challenge and like turning it into a
Mhm.
like opportunity. So like post Brexit, maybe the UK could like move faster in terms of varieties of like public health policies, like minimum unit pricing across the UK. For some of you who don't know what that particularly means, the Scottish government had to dramatically delay its plan to introduce minimum unit pricing for alcohol as a health protection measure. And this was largely because the Scotch Whisky Association, which is supported by European spirits and wine lobbies, challenged the decision all the way to the European Court of Justice, claiming it would disrupt the internal EU market.
Yeah,
So, like, there's definitely some opportunities if people put their heads together and like try to
yeah,
frame it in a positive light.
I totally
But
agree with that.
yeah,
Yeah, I
yeah,
totally
yeah.
agree. Yeah.
Yeah. So like, I guess we can move into some like summary points to consider. It's clear that the UK will have major public health opportunities and challenges to address as a result of Brexit, but so will neighboring countries like Ireland. And how will the influx of migration into an English-speaking EU member state mean for Ireland's public health and social care systems? And how will it impact their people's cost of living? The UK will also have to consider robust mechanisms to reduce the loss of medical and allied health professionals to ensure that the NHS can remain fully functioning.
Yeah, and I would say for my people, especially like public health professionals, I think we must advocate and like push towards ensuring that health is not pushed aside for trade and reducing public health aid gains. So I would say public or health should be on the agenda and should be top priority. And innovations will need to actually be generated in the pharmaceutical markets to ensure that both EU and UK citizens can benefit from life-saving medicines. And finally, I would say collaboration will be required now more than ever. So, partnerships and collaboration to ensure that Brexit doesn't have ripple effects in health and development projects beyond the European continent. So, I would say that will summarize our points for today, and we look forward to hearing from you. And I would say for our audience, we would like you to answer these questions. Are there any other consequences for Brexit and public health that we have not explored? What are your thoughts? And Charles, yep.
Yeah, and I guess to like cap off the conversation, as we try to do with every podcast, just want to say, be nice to someone today, show some empathy, because you, me, and everyone on this planet, we're all that we have. And we hope that you enjoy the
Great.
day
Yeah,
and
have
join
a
us for our
lovely
next
day.
podcast.
Yes, bye.
Bye bye.